you tell us what is oral cancer?
Fungus is also called as mucormycosis. Usually, oral cancers are not seen in young individuals. Cancer can happen in any part of the body. Ayushman Bharat covers you with cancer.
So thank you for taking time and joining us today on our channel.
Thank you, Shilpa.
What we're focusing on is to try and bring awareness on cancer.
Yes.
So you're an oral and a maxillofacial surgeon, right?
Yes.
Could you please tell us what it is?
Long story short, so we
Sure.
come as a special creed of surgeons, so which is a bridge specialty between dentistry and medicine, which is there.
Okay.
It's a super specialty. So we do it as a 3-year master's program, which is there. So we are jaw surgeons. So we specialize in disorders of the face, disorders of the jaw,
Okay.
and disorders of multiple things, including cancer, including cleft lip, cleft palate, which would be there, and disorders of the TM joint or the jaw joint which is there in the face called as TM joint, problems of that, including dental implantology as well.
Okay.
So we come as a holistic perspective. We together as a team we can work alongside with multiple other medical specialties.
Okay.
It is a internationally recognized program which is there across the world. So we categorically call ourselves as oral, which is there, which is the mouth. Maxillofacial is this region, the face region.
Okay.
So maxilla is the upper jaw, which is there, and the facial part. We also specialize in traumatology of the face, basically to fix fractures of the face.
Okay.
So fractures of the face are usually not fixed by orthopedic surgeons.
Okay.
The reason behind that, because of the intricacy of the bone structures which is there. So we do have super specialty training in traumatology to basically know how to fix fractures of the face.
Okay.
And what gives us an edge would be that you look out for basically patient's complete restoration of function, where we will be able to give the edge over any other person when they fix the particular fractures which would be there. So it is a very holistic and a very big specialty,
Right.
which would be there.
So do patients really approach you directly or are they referred before coming to you?
It is two channeled. So we do have a channel where in which you get reference. Let me give you one example.
Sure.
If we rewind us about 3 years ago or 4 years ago, we were plagued by one of the biggest diseases which was there alongside with COVID, if you might remember, which is called as black fungus. Black fungus is also called as mucormycosis. That used to eat the upper jaw. Role of maxillofacial surgeons were immense at that point of time, basically during surgery, which is there. We, alongside with the ENT surgeons, worked extensively to treat these patients for mucormycosis, which is there. Exactly 3 years back. Sorry, 4 years back.
Okay, during COVID, I would say.
Yeah, second wave of COVID.
Okay.
When 4 years back, due to the second wave, which would be there was a sudden surge in rise of this black fungus cases all across India, which is there. And our specialty, the folks of our specialty, came up to serve thousands and lakhs of patients across the country, which is there. And we were trained to do that. Alongside with the ENT surgeons, we were able to give a lot of results. And finally, to rehabilitate the patients as well, whoever had black fungus, which was there.
So I'm sure people don't know that it's black fungus when they come to you, right?
No, they generally don't come to us like that.
Yeah. So the reason I asked you this question is, what kind of people can actually approach you directly?
If patients
What kind
want,
of issues would they come with?
most simple ones would be difficult extractions of teeth, which would be there. So where it is called as impaction or third molar surgery, the most common one. If you have a small ulcer in the mouth, you would approach. If you have a clicking joint or jaw pain associated with ear pain, which would be there, or deviation of the jaw, you can approach. Usually, as a hospital-based practice, we have trauma surgery, which is there when patients come with fractures. So we are called in as experts to come and treat the associated trauma of the face. The orthopedic surgeons fix all the other bones in the body, except the face, which is there. So we are called in at that point of time.
you have something as simple as an ulcer, right? I wouldn't think that it would be something very major for me to approach a doctor unless it doesn't go in a certain time. So how do we recognize that something as simple as ulcer is to be given care?
Two things. Ulcers are of multiple types. Multiple types.
Okay.
It could as well be a heat boil which would be there. Very much a heat boil which would be there. We get something called as aphthous ulcers. Aphthous ulcers are very common in fact. And it is also more common in women.
Okay.
Especially during the time of the month. Menstruation or the periods which would be there. It is usually common because of nutritional deficiencies which is associated with that. It could be single in number, multiple in number. You have two types of it called as major aphthous and minor aphthous. Minor aphthous could be just a small ulcer below your lip. Major aphthous, it could occur as big ones across.
Okay.
That wouldn't be of such a major concern to us. But the treatment would be very simple. We would just give you multivitamins for a couple of weeks, which would be there, followed by some painkiller gel and antibiotic gel inside the mouth to basically cure it.
Okay.
But at some point of time, you might have an ulcer, which could be because of a tooth which is broken, or which could be because of some part of the teeth, or if you have a history of chewing tobacco or smoking, and it is in a conspicuous area inside the mouth, which would be there, something like a palate, something like below the lip or below the cheek or below the tongue, which would be there, which is not resolving over a week or 10 days, which would be there, better visit a specialist.
10 days is the period you...
Approximately. So, we can't categorically at the like 9th day you come or something.
Yes.
When you observe that this particular lesion is not resolving and probably increasing in size, which would be there, that would be the best time to come and visit us.
Right. Okay. All right. So, moving to the oncology part of this, could you tell us what is oral cancer?
Oral cancer is one of the highest causes of cancer. If we can say, it contributes to anywhere from 12 to 15% of diagnosed cancers in India. It is one of the largest. It is in second to cervical cancer, it is in second to, but in men, one of the highest cancers of occurrence which occurs after prostate, which would be there, is oral cancers. We see it to be very common. Mostly it is associated with habit of tobacco.
Okay. So,
Tobacco,
mostly it's that.
yes. And this is mostly associated with tobacco. If you see out of 100 patients that we see it with people chewing tobacco as cancers, or for example, I have a bucket of people who are oral cancer patients, more than 90% of them are associated with some or the other form of tobacco which would be there. Tobacco as in we have different forms. Tobacco is available in multiple forms which would be there. So, we can broadly categorize it into two types called as smokable and chewable.
Okay, so you're talking about the chewable.
Both.
Both. Yeah, tobacco is
tobacco.
True. I think a lot of younger generation is now into this sort of a lifestyle, right?
Yes.
Is there an age that you would say is a threshold for people who come to you for getting diagnosed with oral cancers?
My youngest patient would be somewhere around 20 years.
Okay, as young as 20.
As young as 20. The major bucket of patients who come with oral cancer are associated with tobacco. They can also be associated with other things, such as gene mutation is one of the things, and another one is HPV infections, human papilloma virus infections, which are very minor, when you compare it to the major ones, which is due to the tobacco, which would be there. And usually oral cancers are not seen in young individuals.
Okay.
They are not seen in younger individuals.
But it is possible, is what you're saying.
It is possible. But if a person, like for example, you have a kid who has a peer pressure of his friends that they chew tobacco, or smoking comes in at a very young age. Smoking comes in at around 16 to 18 years. When he goes out of the school, he's entered college, and the kid would see his friends taking a drag or taking a puff of cigarette, or many times he would start eating pan after eating lunch, or he would see all of these advertisements which are basically surrogate ads, which would be there. For example, Kamla Pasand is there, Pan Parag is there, and other things. And the curiosity builds over the fact that it's actually a pan masala, which is basically made of tobacco. But they surrogate it as something like pearls, elaichi, and other things, which is packaged in that particular way. But the thing is that his favorite star
is there.
And he's having it. Many people in rural background would slip into it through that, which would be there. And once he's hooked onto it, nicotine is a very, 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 very high addictive agent. It will cause you a lot of addiction. Nicotine is a very, very potent addictive agent. And you hook onto it, you're hooked onto your life.
That's true. Other than tobacco, what else could probably give this addiction?
It can be alcohol. It can be, even for that matter, different types of food.
Like?
Junk food is an addiction.
No,
but
that could lead to cancer. I'm talking
that
those.
could lead to cancer. If we talk about that, yes, alcohol is an addiction, which would be there. And some people develop habits which could cause some bit of cancer. Like, for example, picking up a particular part of the mouth wherein which they would chew, or we have seen that.
Okay.
I had a patient of mine who was a 32-year-old guy who was clean, absolutely clean. He had developed a habit that in between two teeth, there was something getting stuck there. And he would try to pull it out for the whole day. And he has done it for months. And ultimately, he has rubbed the tongue so much that it has caused cancer.
Okay. That's, I mean, no one would think about it on those lines, right? Yeah.
Yes. So, if we talk about cancer, it could also be tongue cancer is the most common cause of tongue cancer, would come through basically a sharp tooth inside the mouth. Best example, somebody eats something hard, like he might get a stone inside whenever he's eating rice or something like that. They break the tooth and you have a sharp uptending tooth. Whenever they speak, whenever they swallow, the tongue rubs.
Right.
And what it causes is what is called as repetitive trauma.
Okay.
As you said earlier when you asked me at what point of time to come back to us, understand that it could just be a very simple thing of tooth getting rubbed on your tongue, causing what is called as traumatic ulcer.
So, doctor, could you just let us know what exactly cancer is?
What is cancer? You might have seen civil wars which happen in Africa. What is a civil war? What does civil war mean?
War inside.
So it is your own folks.
True. Yeah. Within the
within the country, and your own people within the country go and fight. Go and create a big ruckus around where you're killing yourself and killing your own relatives and friends, which would be there, your fellow countrymen. In the same way, cancer is nothing but basically if your body signaling passages which happens through your cells, which would be there. Each cell has a timeline in the body. For example, our RBCs or red blood cells have a timeline of about 120 days. 4 months is the life cycle of an RBC. We are not the same cell which was produced when we came out of our mother's womb, which is there. There are multiple signaling factors which cause basically to increase in the amount of cells in the body. Like, for example, I might be eating a lot of stuff. I might hurt myself. when you hurt yourself, like think so you might have a cut in the lip whenever you might be having something a little sharp. That heals over the next few days.
Right.
Which would be there. The healing again is a part of cell regeneration.
Okay.
Our body cells regenerate continuously and progressively. Over months and years, and everything regenerates. So with that, if there is a break in the pattern somewhere and it regenerates in some way, that it is just keeping on regenerating and it doesn't control itself. That is cancerous growth.
Okay. Okay.
That could be with multiple factors. You categorically call it as carcinogens. Carcinogens are nothing but factors which are responsible for causing you cancer.
Okay.
Cancer can happen in any part of the body. If I tell the cell going rogue, cell going crazy and completely out of control is what is cancer. So you do have, like, not everything is cancer. See, cancer is a generalized term. Very much it could be, which would be there. It's a huge term. But we also get some things called as malignancy, which is cancer. Actual cancer is called as malignancy. So if we split it into two, so we have what is called as benign lesions. Benign lesions sometimes can also be very harmful. If it comes in places where you do not have place and you have very vital organs around, benign lesions can also cause you a lot of problem. For example,
it can be fatal?
Yes, many times. If it comes in the brain. You don't have space, you have vital organs all around, which is there. So benign lesions are also cells going rogue, but it has not gone so rogue.
Okay.
So it stops, and at some point of time it stops. It doesn't multiply. And cancer has this potential, which would be there, or a malignancy has this potential to spread. For example, let us talk about oral cancer. Oral cancer starts up in the mouth. And the first part of node, it can come into the lumps in the neck. Leave that, it jumps into the lung.
Okay.
Leave that, it sometimes jumps into the liver, which is there. If you talk about breast cancer, which would be there, it might be a small lump which comes in the breast, starts it up as a lump. It comes into a lymph node which would be below your shoulder, which is there in the armpit. You will have a lump over there, and that is a free track to get it into spine. It might shoot into the liver, it might shoot into the abdomen, it might shoot into the lung, which is there. So this is called as malignancy. So when cancer, if we talk, so we have, if we tell it, if I talk about it in a little technical term, cancer can be divided into three parts.
Okay.
The primary tumor. So we call it as T.
Okay.
So worldwide we use a terminology called as T, N and M.
Okay.
T means tumor. What is the size of the tumor? N means the node. It goes, usually these lymph nodes are like drainage of the body. This drainage of the body is basically from all parts, our cell waste is taken out. So this comes to the next node. And if the node is involved, we will call it as nodal metastasis. And finally, if, for example, a person has oral cancer and there is a lump which is starting up inside the lung, which would be there, that is the distant metastasis which is there. Cancer can happen at any part of the body. Sometimes it could be because of physical carcinogens, chemical carcinogens, a combination of physical and chemical carcinogens, or it could be just the genes which is inside your body which has gone mad, which could be hereditary. which is there.
How do we know that we're possibly going towards the path of cancer? What are those symptoms to look out for a common man?
Depends on where.
Anywhere in the body. Like when you know something is not normal, generally that is when we think
See,
of going
if
to
you're
the doctor.
having an unplanned weight loss, if you have malaise, meaning weakness,
Okay.
for a period of time, for a few weeks, few months, which would be there, unexplained.
When you say weakness, do you mean tired and fatigued?
Tired and fatigued,
Okay.
which would be there, associated with weight loss, which would be there. That's at the right point of time to
Check.
go and search for cancer. It could be just a very simple test, which is called as an ultrasound scan of the abdomen to be done, which can detect. If there is a family history of cancer, then go and get yourself checked, which is there. So coming back to cancer, which would be there, weight loss is one of the most unexplained weight loss, which is there. But in certain cancers, especially something like head of pancreas and other places, these cancers, they go undetected. When they come into detection, best example would be Steve Jobs or our previous defense minister, Manohar Parrikar. Even with the best medical systems which is available in India or the world, they couldn't save him. Reason behind that, his cancer was diagnosed at a late stage. Reason behind that, he did not have any symptom until it came out very late, which is there. That would be the misfortune that we have to deal with cancer. And think so, if we are talking about colorectal cancers, which would be there, this is also one of the most common problems, because we eat just junk and shit outside, which would be there. One is if you have chronic constipation for a very long time, associated with some amount of bleeding when you pass stools.
That's to look out for.
That is to look out for. You go to a gastroenterologist, get a colonoscopy done, see that, and at some point of time, if you're seeing that for multiple days your stool is turned very dark, which is also called as basically occult blood in the stool. It's a simple test. You have to do a stool test, which is just to confirm that if there is blood or not. So polyp develops in the gut, which would be there, which can again cause cancer if left untreated, which can cause what is called as colorectal cancers, which would be there. That is associated with weight loss though.
Okay.
If detected early, they are cured almost 100%. For that matter, with detection, which would be there, early detection is good. But can we at one point of time detect it early is also the fate which is left. So the thing is that it can develop. It is also the genetics which is in play. If they would be genetically stable, which would be their history of no cancer in the family, then they are more or less safe, which would be there. That could be associated with 100 other problems.
True. Including lifestyle.
Including lifestyle, which is there. So this would be categorically asking you how it goes with cancer.
How important is early detection? Could you, before that, could you also speak of the symptoms in your specialty or role?
We eat about 6 times daily. So if you're having difficulty in chewing food, if you're having difficulty in swallowing food, if you're having difficulty in basically your mouth is feeling burning, if you're feeling very uneasy inside the mouth, or there might be a discomfort which would be there, just come to us. More or less, in most points of time, oral cancer starts up as a small bubble inside the mouth.
Okay.
Or a blister inside the mouth, which breaks and which forms into an ulcer. Usually of the size of a peanut, or probably less than half the size of the peanut. The early detection, the mean survival rate of patients who are detected early is close to 80% of patients will survive after 5 years. 80 to 85%.
So when you say survival, you mean post 5 years and not?
If we talk about this thing, it is called as disease-free survival is what is a term which is mentioned generally. Disease-free survival means this patient has no trace of cancer inside his body. So when you do an intervention or when you do treatment for it, so you see something like lighthouses for your treatment, which would be there. The first lighthouse would come as soon as 1 year. The second lighthouse would come at the end of 3 years. The third lighthouse would be end of 5 years. And in the end of 7 years, if they don't have cancer, we will roll it off that he doesn't have cancer, which would be there.
So it's 7 years.
7 years and plus.
Yeah.
7 to 10 years, which would be there. If he has no recurrence, which would be there. So the whole thing, this disease-free survival is associated with prognosis of cancer. How, when you give a treatment, how good the prognosis of it is, which is there. And there are many things to discuss on that particular front. One would be the quality of life. Quality of life post-cancer could be deteriorated, which is there. And when you rehabilitate the person to bring him to almost a normal function, then the doctor has put himself with one feather in his hat. So that's how the treatment goes.
Okay. So you were talking about symptoms in oral cancer in particular, right? Could you just, let's wrap that.
So symptoms in oral cancer, if I wrap it up, it could be 5 symptoms, which would be there. 1, burning sensation in the mouth. 1, unresolved ulcer, which is giving difficulty. Third, it could be this first one which I elaborated, burning sensation, could be associated with some white patch inside the body, inside the mouth. Number 4, do you have a broken sharp tooth which could be rubbing onto any surface, which would be there. 5, any association with difficulty of swallowing. I'm talking exclusively with oral cancer.
Yes.
If I'm talking about head and neck cancer, which would be there, change of voice. Change of voice is one of the things. You have developed sudden hoarseness of your voice.
Okay.
If you have developed swallowing difficulties post you swallowing larger morsels of food, which would be there, again suspect of cancer.
Okay.
It could be just a small endoscopic examination which can be done, which is painless, which can rule it out.
Okay. Alright. So a general notion that people have is cancer treatment is expensive, right? Why is it expensive? I'll start from that.
Let me give you an example of oral cancer. Oral cancer, if you detect it, the first option for the treatment is surgery. Your surgery, if you have to rehabilitate them to their almost normal function, we need to take a tissue from the other side of the body.
Okay.
Which we take it from the leg, which we take it from the hand, depending on the size of the defect. How much tissue we have taken out, the same amount of tissue has to be replenished from some other part of the body. Average surgery is about 8 to 10 hours. Average per patient. Their cost comes in. Second, radiotherapy as well is expensive because of the equipment which is there. Number 3 is also the medications which you give, the chemotherapeutic medications that it follows with that. These patients post surgery are under your care for up to 10 to 15 days inside the hospital. Post that they will be under your care for a month, and then the second course of treatment starts. Third thing, there are options available. There are multiple schemes available from governments, from NGOs, where your surgery can be done free of cost.
Could you highlight those?
Okay, so Ayushman Bharat covers you with cancer. Ayushman Bharat scheme has facilities available to cover you for treatment of cancer, oral cancer, which is there. So you are covered under that.
Is it specifically for oral cancer?
No, it is covered. Ayushman Bharat is general insurance scheme.
Okay.
It's a general insurance scheme which is given by the government of India. So it covers. If you're talking about a perspective of Karnataka, Arogya Karnataka, and I'm an alumnus of Kidwai Cancer Hospital, which is there. So in Kidwai, we have one thing called as Vajpayee Arogyashri scheme, wherein which oral cancer treatment for underprivileged people is at zero cost. They don't need to pay 1 rupee for it. This is there. And they will just come to the surgery and go. And most of the surgeries are covered under that scheme, which is there. But another thing what I want to tell it to regular people is that buy an insurance and keep to themselves. A small health insurance investment for your family and for you can go a very long way. As little as about 15,000 rupees a year, which is about 1,200 rupees to 1,500 rupees a month, will cover you and your family for any health ailments that is to be treated, which is there. And you can give the best care at the highest hospital as well, which is possible, and where services are available pan India. But if we compare to cost of cancer care in other countries, India is still affordable with respect to cancer care. In fact, patients from other countries come to India for treatment, saying that one is with the highest quality of treatment that they get. Here, all the super specialties of cancers are available. Like we have micro super speciality of specialists who are available for a city like Bangalore. And this level of speciality, if you want to expect in another country, they need to probably sell themselves off with their house and other things to even just visit the specialist. Over here, the treatment is done. This is there. So, medical tourism is booming. You have patients coming in from Middle East, from Eastern European countries, African countries, Asian countries to come here to India, especially to Bangalore, Chennai, Kochi, Hyderabad for treatment for cancers and more.
Okay. So we have good facilities, we have affordable schemes for people. It comes down to detecting, right? People have to be aware that these are signs that you have to look out for.
Yes.
And I think a general notion that people have is cancer is not curable. Cancer means I'm going to die soon. That's what it is. Is it true?
Again, it is like telling if a thief comes to your house, you're dead. A thief could come, just steal a pen and run away. Or just steal something like one gold chain and run away. Or a thief can come to your house, stab you, stab everyone inside the house, kill them and also run away with everything in the house. So understand, cancer is a thief. Thief comes in multiple forms, which is there. Thief could be just a very simple guy, could be just stealing for his night drink. To have a drink in the night, he would have just stolen something from the house. In the same way, cancer, when it occurs, think that this particular cancer is not the ultimatum that is God has given. Treatment are possible, patients are curable, and patients have been cured. We are at a stage wherein which, if we look back about 15 years to today, we are much more evolved with respect to cancer treatment. Everything from diagnostics to treatment planning to the availability of the more modern drugs have been very pivotal with respect to treatment. And treatment is possible. The thing is that if there is something going a little wrong with you, go visit a good general physician who is there. It could just be a normal cold cough which could be troubling you. That could sometimes if you have unresolved cough, or you might cough and some blood might be coming out through the cough, go to a specialist, go to a physician, tell him that hemoptysis is a symptom which is there. Let him do an examination. Let them find out. If they find out a small lump in the lung, get it treated for lung cancer. Or if, for example, your change of voice is there, you are unable to talk. Don't persist yourself that, oh, nothing has gone wrong with me. Think that something has gone wrong with me and get yourself treated. It is there. So, I'm not here to scare anybody with it, but understand that if for a prolonged period of time, more than 10 to 15 days, a particular symptom is not resolving, better go to a specialist or a physician to just go get yourself checked once. Okay. Which is there. It might be just a symptom of some problem which would be there. Not always cancer.